forget. We divide your pituitary gland into two regions, an anterior part and a posterior part. And your pituitary gland secretes at least 6 hormones, more like 7 or 8. And we'll go over that, but the different regions of your pituitary gland will secrete different hormones that we'll see. So here we have the pituitary gland and the different hormones that it secretes. And you can see here that most hormones come off of the anterior pituitary gland side. Growth hormone, adrenocorticotropic hormone, thyroid stimulating hormone, gonadotropic hormone, melanocyte stimulating hormone, and then prolactin. Those are all the hormones that come out of the anterior pituitary gland. Out of the posterior pituitary gland, we have antidiuretic hormone and oxytocin. And we'll go over what each of these hormones does. And you should know in general what all of these hormones does. Again, that would make a great matching question on a future exam as well. So your anterior pituitary gland actions, the anterior pituitary gland will synthesize, create its own hormones, but it will be still under the hypothalamus control. Neurons, so nerve cells from your hypothalamus, will secrete what we call releasing hormones. And releasing hormones will stimulate or cause the production and secretion of a specific hormone then from the anterior pituitary gland. Inhibiting hormones will decrease the secretion of a specific anterior pituitary hormone. So you'll have hormones that will either stimulate production of a hormone or inhibit production of a hormone as well. So here we have how the hypothalamus controls hormone secretion from your anterior pituitary gland. It's under control from your nervous system. So you have hypothalamic neurons, which kind of control secretion, which we call kind of the hypothalamo-hypophyseal portal system. So your hypothalamus sends releasing and inhibiting hormones through this portal system to your anterior pituitary gland. And then the anterior pituitary gland will then release hormones to a specific target tissue or endocrine gland. So that is kind of how we have our control of secretion of hormones coming from the neurons in the hypothalamus, releasing hormones, which act on the anterior pituitary to release their hormones. And then those hormones travel directly in the bloodstream to act on their target tissue or a different endocrine gland. So we'll go over these anterior pituitary hormones first. Growth hormone, often abbreviated GH, targets most of your body's tissues. So all of your body's cells, tissues, bones, cartilage, anything that will help to stimulate the growth of bones, stimulate the growth of muscle tissue, and stimulate the growth of organs. So growth hormone is often kind of heightened during puberty or right before puberty. Some abnormalities with growth hormone: if you have too much growth hormone, that will cause a condition called gigantism. And if that happens during puberty, you'll have very tall kids who will grow up and could be 7 or 8 feet tall. If you have too much growth hormone in adulthood, it could cause kind of an abnormal width of your neck or kind of abnormal growth in your joints. Too little growth hormone causes a type of dwarfism called pituitary dwarfism. So there's different types of dwarfism. And if there's too little growth hormone released, that would be a pituitary type of dwarfism. Thyroid stimulating hormone, abbreviated TSH, targets your thyroid gland. So your thyroid gland is the gland in your neck. So thyroid stimulating hormone travels to your thyroid gland, and then that will in turn regulate thyroid gland secretions of your thyroid hormones. If you have too much thyroid stimulating hormone acting on the thyroid gland, it will enlarge and cause a goiter, which is a big enlargement in the neck that you can see when the thyroid gland gets too big. And if you have too little thyroid stimulating hormone, the thyroid gland will actually shrink. So that's thyroid stimulating hormone. Here is how we regulate thyroid hormone secretion. And this is showing kind of a negative feedback loop. And often the hormones in the body are controlled by these negative feedback loop mechanisms. So here we have the thyrotropin releasing hormone that's coming from your hypothalamus to act on the anterior pituitary to secrete thyroid stimulating hormone, and that is shown here. Thyroid stimulating hormone will then act on your thyroid gland to release thyroid hormones, and thyroid hormones are T3 and T4. T3 is the active form and T4 is the inactive form. And T3 and T4, these thyroid hormones will go on to increase metabolism, increase body temperature, and help to regulate normal growth and development of all of your body's cells and systems. What this red arrow is showing in number 5 is showing the negative feedback kind of mechanism, where when we have adequate levels of T3 and T4 in your bloodstream, so I'm just going to kind of put my up arrow showing we have adequate levels of our thyroid hormones. Those levels of thyroid hormones then go on and turn off production of TRH and TSH from your hypothalamus and anterior pituitary. So the thyroid hormones themselves will regulate the control of more being secreted, because once the level of thyroid hormone reaches its normal kind of homeostatic range, that in turn turns off production of these control hormones that will act on it. So that is a typical negative feedback loop of hormone secretion, meaning that once the level of hormones reach a certain range, they'll turn off production so you don't get too many. If we have a positive feedback loop, and we'll talk about this with oxytocin, the level of hormone, for example, oxytocin doesn't matter, and the level just keeps rising and rising and rising and will never turn off until an end goal is reached. We'll talk about that with oxytocin. Gonadotropin hormone then is sometimes abbreviated GN. The gonadotropin hormone releases luteinizing hormone and follicle stimulating hormone. So luteinizing hormone for females targets your ovaries to promote ovulation or the release of an egg, as well as the production of progesterone. And luteinizing hormone for males targets the testes to help with sperm production and testosterone secretion. Another gonadotropin hormone is follicle stimulating hormone. And in females, it targets the ovaries to mature the production of their follicles to turn into eggs, as well as helping with estrogen secretion. And follicle stimulating hormone for males acts on the seminiferous tubules to help with sperm production. So that's follicle stimulating hormone. To help you remember, it stimulates the production of follicles, which will be the eggs in the ovaries or sperm in the males. Prolactin is one of our, again, hormones coming from the anterior pituitary, and it will target mammary glands and ovaries to get your mammary glands ready for producing milk. So prolactin levels will increase in kind of later stages of pregnancy, closer to delivery, as the mammary glands get ready to produce milk. Melanocyte stimulating hormone, you might have remembered that melanocytes are the cells in our skin. So this hormone stimulates the production of melanin in those melanocytes. And remember, melanin was important for providing some protection against UV rays when you're out in the sun, for example. And then adrenocorticotropic hormone, and these are always common abbreviations you see for these hormones. Adrenocorticotropic hormone acts on the cells of your adrenal cortex, which is the gland or a layer in the gland of your adrenal glands that sit on top of your kidneys. And this hormone will stimulate the production of certain corticosteroids. And we'll talk about different corticosteroids that you have as well. Then we'll talk about the posterior pituitary. So remember, we started our lecture today talking about your pituitary gland. The anterior pituitary gland releases kind of 6 hormones. The posterior pituitary secretes its own 2 hormones, but it does it in a little bit different way. Your posterior pituitary gland actually synthesizes and releases hormones that are produced by neuroendocrine cells in the hypothalamus. And these 2 hormones that are released from your posterior pituitary are antidiuretic hormone, abbreviated ADH, and oxytocin. So those are the 2 hormones secreted from the posterior pituitary gland. So ADH, first of all, antidiuretic hormone, acts on your kidneys to retain or conserve water. And you'll learn specifically how it does that, probably in future classes, how antidiuretic hormone does that. But it's pretty much telling your kidneys to retain excess water. An abnormality with antidiuretic hormone is a type of diabetes called diabetes insipidus. And this has nothing to do with glucose levels. Diabetes insipidus has to do with low ADH levels. So your kidneys, without adequate levels of ADH, your kidneys are producing large amounts of dilute watery urine. So you're basically urinating out all the water instead of retaining some of the water that your body needs. And this can lead to dehydration and thirst. And diabetes insipidus, frequent urination, dehydration, thirst, those are also common symptoms of diabetes mellitus, which is type 1 and type 2 that has to do with glucose. That we'll talk about later as well. But that's antidiuretic hormone. Normally it functions to conserve water. Oxytocin then, so this is the second of our posterior pituitary gland hormones. It targets the uterus to increase uterine contractions during labor. So oxytocin is one that acts through the positive feedback loop mechanism, meaning that levels of oxytocin continue to increase until the baby is born. So there's no kind of turn off switch there. And this describes how the hypothalamus controls the posterior pituitary gland. It's a little bit indifferent in that stimuli from the nervous system act on the hypothalamus to increase or decrease action potentials. These action potentials travel through this hypophyseal tract, which is made of neurons, and the axon endings of the neurons store the neuron hormones in the posterior pituitary. So basically what's happening in your posterior pituitary is the posterior pituitary is storing hormones that are created in the hypothalamus. These hormones will then be released into the bloodstream to activate your target tissues. And again, the only two hormones that are released from your posterior pituitary are oxytocin and ADH. So then we'll go over another gland in the endocrine system, your thyroid gland. It's one of the largest glands and it requires iodine to function. So years ago, in like the 30s or 40s, they added iodine to salt. And you can still buy iodinized salt to this day. And if you don't, it's okay because we get iodine from other aspects of our diet now. But it requires iodine to function and it secretes your thyroid hormones as well as the hormone called calcitonin. Thyroid hormones are secreted by follicular cells to target most of your tissues to help regulate metabolic rates, so turning food into energy, and then also regulating growth of normal body systems. And then calcitonin is secreted by what we call the parafollicular cells. It will target bone and some other tissues. And what calcitonin does is it reduces blood calcium levels when they're too high. Another way to remember what calcitonin does is calcitonin tones down or decreases blood calcium levels when they're too high. These are two very important thyroid hormone disorders, which some of you have probably heard of or you have personal experience with, either in your family or extended family. My own mother has hypothyroidism, but they refer to the level of thyroid hormones in the blood. So someone who's hypothyroid has a decreased level of thyroid hormones in their blood. And someone who is hyperthyroid has too many thyroid hormones in their blood. For someone who is hypothyroid, they have a decreased or slowed metabolism. So they usually have problems with gaining weight, or they can't lose weight. So they gain weight, they have a reduced appetite, they're very tired, they have a low temperature and pulse, they have dry, cold skin. It can cause myxedema in adults, which is kind of like a swelling or bloating of the face and hands, or creatinism in infants, which have to do with creatine levels. So hypothyroidism, I'm just going to put a down arrow because it means that there's a decreased levels of thyroid hormones, and all of the body systems kind of slow down. In hyperthyroidism, I'm going to put an up arrow because in hyperthyroidism, this means the levels of thyroid hormones have greatly increased and all of the body systems are kind of put on high alert. So there's an increased metabolism. So these people are very thin. They lose weight, they have increased appetite, and they're nervous because their anxiety levels are very high. Their nervous system is kind of put into high gear. They might have heart palpitation, their heart beating rapidly. They'll have a higher temperature and pulse. They'll have warm, flushed skin. And Graves' disease is an autoimmune condition that leads to hyperthyroidism, where your body creates too many thyroid hormones. It can lead to a goiter because your thyroid is just kind of on high alert. So the thyroid gland will actually increase in size. And that can be seen through the neck as a goiter, which is like a big lump in the neck itself. Then your parathyroid gland, so this is another gland, it's located on the posterior side of your thyroid gland. It releases parathyroid hormone that targets bone and kidneys, and it helps to regulate blood calcium levels even more so than calcitonin. So for example, if calcium is low, it'll stimulate osteoclasts to break down bone, to put bone into the bloodstream, as well as trying to retain calcium from your kidneys to try to get calcium back into the blood. And if calcium levels in the blood are too high, then osteoclasts don't break down bone and more calcium is tried to urinate it out to get rid of excess levels of calcium. So this shows regulation of blood calcium levels. So again, at number 1, we have our normal homeostatic range of blood calcium levels. And if homeostasis is disturbed or blood calcium levels increase more than they should, then we have receptors which will decrease parathyroid secretion of the parathyroid hormone. So that will decrease bone reabsorption and decrease calcium uptake from your intestines and kidneys to try to get these calcium levels back low into normal range. If blood calcium levels have been decreased, so if they're going too low, parathyroid hormone will increase its secretion in order to increase bone reabsorption and calcium uptake from your kidneys and intestines to try to increase blood calcium levels back into normal range. So that's how blood calcium levels are controlled. Here we see your thyroid gland. It's kind of a butterfly-shaped gland located right below your thyroid cartilage where you'd feel your Adam's apple. And then on the back of the thyroid gland, you see the parathyroid glands, as shown here, they're little yellow pea-shaped sizes. And then you see the different cells, parafollicular cells and parathyroid cells producing the different hormones. So that's your thyroid gland and your parathyroid gland. Adrenal gland actions then. So your adrenal glands are 2 small glands located right on top of your kidneys. And each adrenal gland has an inner part called the medulla and an outer part which we call the cortex. And the adrenal medulla and the adrenal cortex function as completely separate endocrine glands. So you can see those as shown here. So here we have the adrenal gland sitting on top of the kidneys, and you can see the different layers of the adrenal gland. The cortex is the outermost layer, and the medulla is the inner layer. And then we can divide layers into different, the cortex into different layers based on what they will secrete: androgens, glucocorticoids, mineralocorticoids. And then the medulla secretes all of our epinephrine and norepinephrine, which are kind of like our adrenaline hormones, to get our body ready for stressful situations. So that is the medulla and the cortex. So here is a little more about hormones that come out of the adrenal medulla, are epinephrine and norepinephrine. These will target your tissues like your heart, blood vessels, liver, and fat cells, all released as a part of the fight or flight response in your sympathetic nervous system. So these are your adrenaline hormones that get released to get your body ready for activity. Here is regulation of the adrenal medullary secretions. Physical activity, low blood glucose, other stressors will control stimulation via sympathetic nervous system stimulation. That's our fight or flight response. And then epinephrine and norepinephrine will have these effects on different target tissues, increasing the release of glucose from the liver to be available into your blood if it needs to use it to create energy, decreasing blood flow, increasing blood pressure, increasing metabolic rate, decreasing the function of all of your visceral organs. So these are all the effects of your adrenaline hormones, epinephrine and norepinephrine. The adrenal cortex hormone, so remember your adrenal cortex was the outer layer of your adrenal gland. A big one that it secretes is aldosterone, which targets your kidneys to retain water and sodium ions. So it's kind of indirectly involved with controlling your blood pressure and blood volume. It causes sodium and water to be retained. So if your kidneys are retaining sodium and water, that sodium and water is going back into your kind of fluid levels of the body to increase your blood pressure and your blood volume. So that is aldosterone. Here we have regulation of aldosterone secretion. If you have an increased, let's say we have a decreased level of sodium, that will tell your adrenal cortex to secrete aldosterone, and aldosterone in turn will try to retain more sodium and decrease water loss. What also happens is your kidneys will secrete its own hormone called renin, which acts on angiotensin to be converted to angiotensin II that will also constrict blood vessels. When you constrict your blood vessels, that also helps to increase blood pressure in the body. So any decreased level in sodium, or if you have a decrease in blood pressure or you've lost a lot of fluid, aldosterone will be kicked into gear, and renin as well, to try to increase blood levels as well as increase blood pressure levels as well. Cortisol is a type of glucocorticoid that targets most tissues. It functions to increase the breakdown of fat and protein to use for energy uses to try to reduce the inflammatory and immune response. So that's what cortisol does. And here's a regulation of cortisol secretion. Pretty much if you have any low blood glucose levels or other stressors, that will encourage adrenocorticotropic hormone to release cortisol. And again, this is a negative feedback loop, in that once levels of cortisol are adequate in the blood, they will turn off the secretion of more cortisol secretion. But cortisol, what it will do, it will have anti-inflammatory effects, increase lipid and protein breakdown in order to increase blood glucose levels. So that is cortisol. Androgens then also target most tissues. Androgens are sometimes known as our sex hormones. So estrogen, progesterone, testosterone. In males, they'll help develop secondary sexual characteristics. And in females, they'll help control or regulate the sex drive. All right, then the pancreas is it's considered what we call a mixed gland, because it has an exocrine portion and an endocrine portion. The exocrine portion secretes digestive enzymes into your small intestine to regulate digestive processes. And the endocrine part of your pancreas consists of pancreatic islets, which are kind of groups of cells dispersed throughout the exocrine portion to release insulin and glucagon, which are two endocrine hormones to help regulate blood glucose levels. Here are pancreas actions of the islets. So the islets consist of 3 cell types, each of which secrete a different hormone. Alpha cells secrete glucagon, beta cells secrete insulin, and delta cells secrete somatostatin. So you should know what those 3 cells secrete. And these 3 hormones will work together to regulate blood glucose levels and other levels of nutrients. So here we have the pancreatic islets here. So the pancreatic islets of the endocrine portion are shown here in kind of this multicolored kind of islet. You can see the delta cells secreting somatostatin, alpha cells secreting glucagon, and beta cells secreting insulin. Surrounding here are what we call the acidae, which are the endocrine glands that will secrete their digestive enzymes directly through a duct. And this duct will be the pancreatic duct that takes those digestive enzymes and empties them out into the duodenum, or your small intestine. But we're going to focus on these pancreatic islet cells, which will secrete our hormones to help regulate blood glucose levels. What insulin does is, I'm just going to put a down arrow for insulin, because insulin lowers blood glucose levels. So it targets your liver, your skeletal muscle, and adipose tissue where glucose might be stored. It helps to regulate blood glucose levels. It specifically lowers levels of glucose in the blood. So for example, after a meal, your glucose levels are very high because you've eaten all this food. Insulin will be secreted to try to lower those blood glucose levels. What insulin does is it takes sugar or glucose out of your blood, and it stores glucose in the form of glycogen, and it will store it in your liver, your skeletal muscle, or in your adipose tissue. Diabetes mellitus, type 1 and type 2, is caused from too little insulin or faulty insulin receptors. The symptoms are always an exaggerated appetite, excess urine, dehydration, thirst, and fatigue. You can be type 1 diabetes mellitus or type 2 diabetes mellitus, and they're very different. In that type 1 means that you're insulin dependent. It means that your beta cells in your pancreas are not secreting adequate amounts of insulin. So you daily need to give yourself an injection. Type 1 diabetics, anyone can become a type 1 diabetic. It's something that you might be born with. You could develop it later as an adult, but it's not anything that you're doing to create type 1 diabetes. Type 2 diabetes, these people can be insulin independent. So their beta cells are producing enough insulin, but the insulin isn't responding or doing its job because of outside factors like obesity, poor exercise, poor nutrient habits. So usually type 2 diabetics develop in people who are obese or who have very poor nutrition habits. It can be treated with diet, but it can eventually turn into type 1 diabetes. So type 2, eventually these insulin independent people could turn into being insulin dependent, where even though their cells don't respond to insulin anymore, they still need insulin to function. Stress causing diabetes, I'm not sure specifically about stress. I think stress can cause you to eat more or have poor exercise and health habits, and that in turn could cause type 2 diabetes. But type 1 diabetes is totally, kids are born with this, adults might develop it later. But that is just when your cells can't create the insulin they need. Type 2 is a little more about environmentally controlled. Good question. Glucagon, I'm going to put an up arrow with glucagon because the glucagon increases blood glucose levels. So it targets your liver. What glucagon does is it goes to your liver where glucose is stored, and then it takes out the glucose and puts it into the blood. So it tries to increase blood glucose levels. So between meals, glucose levels will drop and glucagon will be secreted to allow the glycogen to be broken back down into glucose to try to go back into your blood to increase levels of glucose in the blood. So here we have these two major hormones and how they regulate your levels of glucose levels in the blood. If glucose levels are too high, we'll go up here. Basically, we have insulin, which stimulates glucose uptake by liver, muscles, other tissues to try to get excess glucose out of the blood. So that tries to bring down our glucose levels. If glucose levels are too low, like in between meals, then we have our glucagon as our kind of instigator to try to decrease insulin as well as increasing glycogen breakdown to try to put more glucose back into the blood, getting it from your liver or other sources. So that's how we regulate blood glucose levels. The testes hormone, the big one here, is testosterone, targeting most tissue throughout the male aiding in sperm and reproductive organ development as well as function. And then estrogen and progesterone also targets most tissue in the female. It's involved in the uterine, mammary gland development, as well as the menstrual cycle. So what estrogen and progesterone do is levels will increase right kind of before possible pregnancy or ovulation. And then the levels continue to increase if there is a positive pregnancy as the uterus kind of gets ready for a possible implantation for a developing embryo and fetus. So what birth control pills are levels, you're basically taking estrogen because you're tricking your body into thinking that it's pregnant so that it won't ovulate an egg. So that's what some birth controls are, they're just estrogen pills. Thymosin is a hormone from your thymus gland, which helps to target immune system tissues to help promote proper immune system development and function. And then we'll end with the pineal gland hormone producing melatonin. It targets your hypothalamus and it plays a role in the onset of puberty, as well as controls your circadian rhythms, which is your sleep and wake cycle. So melatonin will be secreted to help you fall asleep. Light will affect its function as well. So if you're in a darker room, usually that will stimulate more melatonin to be secreted to help you get sleepy. So that's the endocrine system. And I'm going to stop the recording there because I think we'll wait